It can be isolating to find yourself with a drug or alcohol issue, or for somebody that you care about to be in that situation. Often people struggle to know how to deal with the problem, and embarrassment, stigma, and fear can get in the way of seeking help from the usual sources of support. Drug and Alcohol Helplines offer confidential, non-judgmental support, information, guidance and referral. They can help when a person is feeling at sea or overwhelmed by the pressures and conditions of their situation. They offer a private and safe space to talk things through and get impartial support. Drug and alcohol helplines are generally all about accessibility. They offer confidential support and information to help the person improve their situation. These services are low cost or free and are accessed through phone, email, SMS, chat, Skype, etc. There are drug and alcohol helpline services across the world and across Europe. FESAT is the EU network of drug and alcohol helplines. For over a decade, FESAT has been running EU-funded projects focusing on best practice in the helpline field. We asked drug and alcohol helpline workers and coordinators what areas of training and development they felt they needed to work on. This research in 2015 and again in 2016 told us that there was 3 areas of identified need. These are burnout prevention, new psychoactive substances or NPS, and co-occurring mental health symptoms and substance use. We formed a partnership with these services and were successful in getting funded to do this Erasmus Plus Key Action 2 partnership project in late 2016. The Skills and Knowledge Exchange Project for Drug and Alcohol Helplines, or SKEPDAH for short, has partners from Ireland, Bulgaria, Belgium, Cyprus, Germany, Netherlands, Norway, Portugal and the UK. A key element of this project has been the transnational project meetings. We've had 5 in total over the life of this project, during which we pooled our knowledge and experience and resources in order to create 3 curricula that can be used by similar services in the 3 areas of identified need. The first topic to be looked at by the SKEPDAH project was burnout prevention. Burnout and compassion fatigue can affect anyone in a caregiving role. Helpline workers are often exposed to trauma as callers recount their experiences to us. This can happen throughout a helpline worker's career, which is why raising awareness of the signs of burnout and looking at measures to prevent or reduce it are very important. This project created a curriculum for burnout prevention, focusing on helping helpline coordinators and trainers to consider the key learning outcomes in this area, and what good practice looks like, and what research and resources are available. On this topic, awareness, self-care and supervision are crucial. Piloted training inputs that used this curriculum found that trainees liked the self-care tips and liked being able to self-assess for burnout. They also liked that their organisations were considering their needs at this broader and deeper level. Drugs and drug use patterns change over time, but in recent years there has been a particular escalation in the ever-evolving world of new or novel psychoactive substances, or NPS. The precise nature of these drugs and their consequent effects changes regularly, so for drug and alcohol helpline workers it presents a great challenge. This is the second topic of focus for the SKEPDAH project. The NPS curriculum was aimed at increasing the quality of and confidence in how drug and alcohol helpline workers deal with NPS queries. The curriculum looked at how to learn more about the nature of these drugs, as well as looking at best practice in how queries are dealt with. Feedback from training inputs based on this curriculum was that trainees were happy to get guidance on where and how to get up-to-date information, but also to have permission to not know every detail in an area where not everything is yet known. They felt more confident as a result. Alcohol and drugs have been used in parallel with mental health issues for centuries. This topic comes up repeatedly and was the third area of focus for this project. The area of dual diagnosis, or co-occurring mental health symptoms and substance use, creates challenges in presentation, boundaries, policy and best practice in helplines. The curriculum on co-occurring mental health issues and substance use focuses on learning outcomes around knowledge and awareness, practice, policy, supervision and boundaries. The message that we cannot diagnose or treat and must work within an environment where services are often limited were very important. Feedback from training inputs based on this curriculum were positive. Those who attended liked the shared resources and best practice notes. There was also some relief, but perhaps the need for more work and supervision around our desire to diagnose unofficially when we cannot. The 3 curricula produced by the SKEPDAH project, thanks to Erasmus Plus funding, are now available to download through the FESAT website on www.fesat.org and through the project partners' websites. If you have any feedback on this presentation or want any more information on the SKEPDAH project or on the curricula that this project produced, please contact us on info@fesat.org. That's info@fesat.org. Once again, we wish to acknowledge that this Skills and Knowledge Exchange project for Drug and Alcohol Helplines was funded by the Erasmus Plus program of the European Union. For more information, visit www.ec.europa.eu/programs/Erasmus-Plus.